Next exercise we're going to do is stretching for the pelvis and the hip. Now I want to remind you, if you haven't seen this, go and look at the lunge, because it demonstrates the psoas muscle, which is the strongest flexor of the thigh. When we're sitting, these flexors shorten up. And so when we get up from a sitting to a standing, sometimes we feel like we can't open that hip up altogether. So we talk about the lunge. You can go back and look at that video. This next one we're going to talk about, so the psoas is inside in the pelvic area. The piriformis muscle attaches to the sacrum and to the hip. And to do that one, a lot of people, they'll be laying down and they'll do this type of thing and they'll reach through and pull. That's not a good exercise because your legs are stronger than your arms. So this one uses gravity. And so you just go into this, we call this the figure 4 position. Support the ankle, push on the knee. At the same time, you bring your posture up like a rope or a string is, pulling your head straight up. And then I'm going to turn it just a little bit this way. I'll just turn my body. And as you exhale, take a deep breath in, 4 seconds in, 8 seconds out, and reach out. I don't want you going straight down because that compresses the spine. I want you up and out. You will hinge at the hip. And just keep on going out. Keep on going out as you're exhaling. That took me a year to do that. And I'm so glad I did it because it really helps to open up that hip mobility. Just remember to do both sides. And so, again, you take this in this position, support the ankle, kind of point yourself towards that knee, push, pull on the ankle, posture up, and then as you exhale, reaching out, and then coming down. And one of the things that I started doing as well, and I want to also emphasize this when you're doing the lumbar stretching side to side, take a deep breath in, and as you stretch, exhale 8 seconds, breath in 4 seconds, exhale 8 seconds, hold that position. Same way with here. Hold the position. While you're in that down position, as you've exhaled, inhale, and go down again. Once you get that to the point where you're comfortable there, it's not comfortable, but it's one of these things that kind of hurts good. Then you go to the middle. Same thing. Up, push here, pull on the foot, reach out, do that same thing. Now that one, I'm not quite there yet, but do that same thing. Once you're in that position, breathe in, breathe out. You'll notice that you'll get a little bit more, maybe a 1/4 inch or less, but you're able to calm your autonomic nervous system down as you're continually exhaling twice as long as you inhale.